This is our mental health moment. If there ever was a time for us to all understand what mental health is, its power, how foundational it is for our health, now is that time. In the middle of the largest public health crisis that this country has faced, it's a moment for reflection. We're at a critical point as a country. While we can use cliche statements like, I want it to go back to the way it was before COVID, the truth is the way it was before wasn't working for most of us. Deep-rooted structural inequalities, blatant racism, codified through policy, and a fragmented and antiquated view of our health make today's challenges all the more difficult. We're all in pursuit of flourishing, but it's a fight, one that's going to be harder for some of us than others. But it's a worthy fight and a worthy crusade, and one I know you all are embarking on in your own way. So today, I want to talk briefly about the things that are killing us. From bad policy to social disconnection, we're dying sooner than we need from preventable causes. Context matters here, and the context for this statement is that the United States healthcare story, and in large part, the story of mental health, is grounded in a series of decisions that have created an increasingly fragmented system that costs more and gets less compared to every other country in the world.
In recent studies, including the Healthy Mind Survey and the National College Health Assessment, there's been a rising prevalence in depression, anxiety, eating disorders, and suicidality just within the past decade. Approximately 1 in 3 students meet the criteria for a clinically significant mental health concern. 1 in 3. We're struggling, and we need to be able to seek help without shame and embarrassment. We need to be able to recognize that mental health is just as important as physical health.
Suicide is the second leading cause of death for young adults, for me and for my peers. But mental health also is not just a youth issue. 50% of the population will experience a mental health condition in their lifetime. 50%. And this number will only continue to rise due to current events, a global pandemic, a recession, and changes to everyone's way of life.
According to a recent study conducted by Active Minds, 74% of students reported feeling anxiety or stress as a result of COVID-19. Students also reported feeling a lack of support, as many would not know where to go to seek the help they need for themselves, their friends, or their families. Nonprofits across the nation and around the world are doing their part, but in order for my generation to succeed, we need to address mental health care. What we need is a comprehensive, funded approach to mental health in order to fill in the gaps in health coverage in our communities. We need a plan, and we need it now.
Recently, in partnership with Viacom, Wellbeing Trust worked to learn more about what the American public felt was a priority. And we learned a lot. Data revealed the one and seemingly only thing that nearly all Americans agree on: our lawmakers must do more to address mental health. 91% of registered voters say they want elected officials to focus more on mental health, with 47% going so far as to say that our representatives should do much more. Such a ridiculous majority that it makes it crystal clear that Congress fails in its most basic duty to serve the people they've pledged to protect. Even before the COVID-19 crisis, America's infrastructure for mental health and addiction services was fragmented, overburdened, and underfunded. The coronavirus has put far more stress on that broken system, and we need to provide solutions that allow us to make sure that we take care of patients and families. Grounded in our solutions is a need for the importance of a framework for excellence, because when healthy community conditions, good coverage, and inclusive policies are all in place, we can achieve positive outcomes that improve the mental health and well-being of all Americans. Accomplishing this goal, however, requires a framework that sees mental health as existing on a continuum that begins in community and extends into healthcare. If we're serious about tackling mental health and addiction in the United States, we must leverage all the places and spaces people present with needs and provide support accordingly.
The reality is, when people with mental health and physical health conditions are identified early and receive evidence-based mental health treatment, improved outcomes and substantial savings are achievable. It's time to change the course and prioritize true integrated care once and for all.
I first began to struggle with my mental health when I was in 8th grade. As an 8th grader, I was that overachieving student who always wanted to get the best grades, and I loved playing on the tennis team and reading books and going out with my friends. And all of a sudden, as the year progressed, I began to isolate myself from all of those things that I loved. Tennis stopped, I stopped doing all of these activities, and school became more challenging as a result of the anxiety that I was experiencing at the time. Later, I was diagnosed with an autoimmune disease, which resulted in neuropsychiatric symptoms such as depression and anxiety. However, during that time, I was extremely grateful because I had a family who was very supportive of my mental health, and my dad is actually a psychiatrist, so he was able to spot the warning signs quickly. I realized that I was lucky to have that support because most people don't, especially in BIPOC communities.
As a former high school educator, I've seen our broken system fail our students again and again, especially when it comes to mental health services. I've seen it all: the highly motivated student, the student athlete, the withdrawn student, and the one thing that they all share is that being a teenager is a challenging time to navigate, and they could all use a little help with their mental health. However, the reoccurring issue was always access. I've had to watch students wait days or even weeks just for a meeting with our only school counselor, balancing a caseload of hundreds of students, having to prioritize students with the most pressing needs, even extending her services to the weekend just to make sure students felt heard. I've seen teachers have to also play the role of counselor, except without the proper training or the proper tools. And even more recently, I've seen the early effects of distant learning and what a global pandemic will have on our students. Students who are feeling isolated, unsupported, and overwhelmed. The issue is we've accepted this as okay for far too long, and it's not. It's at the expense of our kids, of our educators, and of our education system.
I had never heard of mental health until I got to college. The conversations and awareness were really hard to find in my community because it was just not a priority in my culture as an Asian American, as a sister, as a daughter, as a student, as someone in the workforce. Whenever things got hard, it just felt like I had to get myself together because that was what everyone else was doing. Well, I felt like I was stuck and struggling. Everyone else was moving forward. And it didn't feel like I could talk to a friend, a family member, because it felt like it was a sign of weakness. It was a sign that I was incompetent and I couldn't pursue a career in the helping professions.
I've learned just recently, I set out on this journey and learned about how overwhelming the mental health related issues are to how many people, how far, how wide. I learned that it was impacting every community, that in fact 1 in 4 of us will experience mental health conditions in our lifetime. I've come quickly to learn that it's in fact, I believe, 4 in 4, because if it isn't you, it's someone you love, somebody in the family, in the community, or in the workplace, but we are all living with it. That in fact it's 4 in 4, and that was pre-COVID. And COVID is about to so overwhelm our communities. It is a pandemic of even greater proportions. The worst part is you've got 2/3 of whom exist in the shadows, and they don't know, they don't have a resources to draw upon, and they don't know how to navigate their way through it. It affects all of us. It affects people old and young, big and tall, black and white, Christian, Jewish, Muslim, and even Democrat and Republican. It's one of the few issues that crosses the aisle. But it's magnified and amplified because of stigma.
You see, I know firsthand what it means to struggle with mental health and addiction. And I also know what is possible with the proper treatment and support. I've been in recovery for over 9 years now, and not a day goes by that I don't feel grateful for the life I was able to build. My hope is that by working together to stamp out stigma, integrate physical and mental health care, and eliminate roadblocks to treatment, that we can empower more people to thrive in recovery. It all starts by normalizing a global conversation around brain health. When people come out of the shadows and share their experiences, it inspires others to do the same. And that's how change truly begins, at the individual level. Everyone has a role to play in the fight for mental health.
I was diagnosed with a mental illness back in high school. Before gaining the courage to speak out about my experiences in dealing with mental health, I felt alienated. The stigma that surrounds mental illness keeps us from talking about it. But along my mental health journey, I have felt most empowered when I have been able to talk with my peers about what I was going through, and finding out that many others felt similarly to me. Normalizing having these conversations is important to normalizing seeking help and actively working on your mental health, with or without a mental health condition. Look, many of us in my generation say without hesitation that we do not judge someone for their mental health struggles. But the reality is, many in my generation and those before me still feel like we will be judged if we struggle. And that remains a huge hurdle in seeking care. It stops people struggling from making the time to find treatment. It stops people in crisis from reaching out for help. It causes needless deaths to suicide. With Active Minds, I know the way to respond to those that are struggling. And I know how easy it is to be there for someone. I don't have to be an expert, and neither do you. We just need to be there for each other, to validate the challenges they're facing and share appreciation for their openness. That's how we change the conversation around mental health.
As an Asian American woman, my dream is to work in places and communities I grew up in, serving as a high school counselor. I know the realities around the stigma around mental health, and I want to empower the next generation to destigmatize conversations about mental health, and I'm going to make that happen in underrepresented populations. But I can't achieve my dream if mental health continues to be deprioritized and underfunded. My peers and I work hard to change the conversation and end the stigma surrounding mental health. And we want to continue this legacy and work with the next generation. And I want to be a part of that, but we can't do that without funding, legislation, and attention. One easy change we can make is to advance the 988 emergency mental health line nationwide. It's time to say that mental health is just as important as physical health. Mental health needs to be a priority in the minds of everyone. Always.
As a high school student, I'm part of a generation that is acutely aware of the challenges facing our world and mental health today. We were born into a post-9/11 world, raised during a global recession and entering adulthood during a global pandemic. But there's nothing we can do to change that. But we refuse to bury our feelings, to ignore our mental health needs, or to be ashamed of our struggles. We are a generation that says, it's okay to not be okay. We will use our voices to make sure that we have the support we need to move forward in a productive way. As president of my Active Minds chapter, I work tirelessly to encourage an open dialogue for mental health and educate my peers about mental health and mental illness. I'm calling on the changemakers of the world to do their part too. Fund mental health care resources, fund research, fund early intervention. Invest in our future, especially since our present has been so hard to navigate.
As the world struggles with the complex challenges of a global pandemic, people from all walks of life are experiencing the mental health impact, some for the very first time. This unique situation is shining a much-needed spotlight on the human vulnerability and the urgent need for whole-person care. Now it is up to all of us to fight for the change we want to see. It's time to demand that our medical professionals be trained to screen for common conditions and work in conjunction with mental health and addiction treatment providers. Demand that insurance companies reimburse providers fairly to maintain diverse networks of care. Demand that our hospital systems rebuild antiquated infrastructures to include collaborative care. and demand that our policy makers introduce and support legislation to fund these efforts.
So while most of us agree that more needs to be done, this crisis around us is only deepening. So what do we do about it? Well, there's three things. Number one, we need leadership. We need leadership for mental health at every level of government, from our communities and our coffee shops all the way up to Congress. We need to make sure that the voice of folks who are experiencing mental health, who understand its power, are in positions that they can be influential. This is truly about positioning people in places where they can make an impact through leadership. Number two, let's integrate care. Not a new concept. We've got to be able to figure out ways that we can bring mental health and addiction services to wherever people show up. It might be any place that you believe you can open up and share with the world or with others your story. So we need to integrate care. Third, we need to invest. Without adequate resources, we're simply going to be flailing. We're going to be tinkering. We need to put billions of dollars into redesigning a system that creates a new structure. Not about putting money back into the things that didn't work before. No, that doesn't make any sense to us. What we need to do is to really think creatively on how we can reassess the structures that we've inherited and move towards a place that new structure has the person and the family at the center of it. By doing so, we'll not only improve outcomes, we'll not only save dollars, but we'll create a much more worthwhile experience for both the clinicians and the community. And I can't imagine a more potent combination when we bring those things together. So it's our time. This is our call to action. What choice will you make?